Hey nursing students! Today we're diving deep into critical care with our biggest hotshots yet, hitting every level of Bloom's taxonomy. Grab your coffee and let's crush these questions together. Starting with knowledge level questions. First up, what's the normal range for central venous pressure? Take a second, got your answer. CVP is 2 to 8 millimeters of mercury. This reflects right atrial pressure and helps us assess fluid status. Next knowledge check, what's your first move for V-fib? 3, 2, 1. Defibrillation. Don't even hesitate on that one. Moving up, what is a Swan-Ganz catheter's purpose? Think about it. These bad boys measure pulmonary artery pressure and cardiac output. 2 more knowledge bombs. Normal ICP range is 5 to 15 millimeters of mercury, write that down. And finally, what's PEEP's main job? Drumroll please, that's right. PEEP improves oxygenation by preventing alveolar collapse. Boom. Let's level up to comprehension level questions. 1. Why do we avoid hyperventilation in TBI? I'll wait, yes. It's because hyperventilation causes cerebral vasoconstriction and reduces perfusion, not good. 2. How does sepsis lead to hypotension? Pausing for you. Shock is caused by systemic vasodilation and capillary leak, that's the real shocker. Speaking of pressure problems, 3. Between attention pneumothorax and cardiac arrest, what's the connection? Giving you just a second to think, increased intrathoracic pressure in attention pneumo compresses the heart and great vessels and leads to reduced blood flow to the myocardium. Remember that one. 4. What does a wide pulse pressure in septic shock tell you? Wait for it, wide pulse pressure in septic shock shows decreased systemic vascular resistance. And 5. Why do we use hypothermia post-cardiac arrest? I bet you know this one. To reduce cerebral metabolic demand and prevent reperfusion injury. You're crushing it. Time for application questions. A. Ocean presents with GCS of 7 after head injury, what's your priority? Think quick. Ensure airway patency and oxygenation. Below 8, intubate. Next, patient is in septic shock and has MAPA 55, your first move. Tick tick tick, the clock is running down. Get those 4 fluids running to pump up the fluid volume. Tricky one next, what's happening when you have continuous bubbling in chest tube water seal? Remember that clinical? Yup. You've got an air leak, my friends, check your patient and check the tube system. And next, ARDS patient, PaO2 of 55 on 100% FiO2, what's next? This is quick, I know. Breathe in. With those numbers, it's time for mechanical ventilation with PEEP. Finally, K of 6.8 with peak T waves, what's the priority action? Got it. Right. Calcium gluconate to stabilize that cardiac membrane, are you exhausted yet? It only gets harder. Analysis. High PCWP on a PA catheter, what's it mean? Waiting. Left ventricular failure or fluid overload. Next, subdural hematoma with ipsilateral pupil dilation, what's happening, and waiting. Uncal herniation, bad news. Next, DKA patient, pH of 7.1, the primary treatment is, giving you a moment and, the treatment for the DKA pH is 4 insulin and fluids. Okay, now, AT4 spinal injury with bradycardia, what's going on? Yup. They have loss of sympathetic tone. Last one, right ventricular strain pattern with massive PE. Tell me the significance. Take a deep breath, future nurses, it shows that increased right ventricular pressure. We ain't done yet. Synthesis time. Acute liver failure with coagulopathy, what are you giving? Thinking. Give them vitamin K, FFP, and watch for bleeding. Second, acute pancreatitis management, go. Pausing. Pancreatitis nursing care means NPO, 4 fluids, pain control, and watch for complications. Third, ARDS getting worse, what vent changes are you expecting? Take a breath, y'all, worsening ARDS means an increased PEEP and lower that tidal volume, protect the lungs. Fourth, subcutaneous emphysema with chest tube, what's up? Do you know? It's air under the skin, check the seal, check the tape, but definitely check the patient. Subcutaneous emphysema may be painful but generally not harmful, especially if caught in time. Think crispies under the skin when you press. Just assess your patient and your chest tube. Last synthesis, MI with cardiogenic shock, what's your treatment plan? Waiting for you to think. Cardiogenic shock calls for vasopressors, inotropes, and revascularization. We're at the last level, evaluation. 1. In a septic shock patient, lactate is 4.5 after 6 hours, is the treatment working? LOL, nope, that patient need more tissue perfusion. 2. TBI patient, ICP 20 post-mannitol, are you successful? Nope. Not yet, the ICP is still not pretty, so keep working. 3. DKA treatment 12 hours in, glucose 200 and pH 7.3, how we doing? Right. You got that one, I'm sure. That patient looks much better. DKA patients can show up with sugars over 900 and a pH around 7. A glucose of 200 and a pH of 7.3 is pretty good if they were in acidosis, but remember it's all about the trend line for DKA, where were we and where are we now and where are these numbers headed? 4. PE patient, heart rate down to 90 post-anticoagulation, winning. You betcha. Last one, ARDS patient, PaO2 of 85 on 60% FiO2, is that adequate? Dramatic pause for the final answer. Yes. That patient is ventilating beautifully, check out that PaO2. That's what we like to see. Fantastic work, future nurses. You just crushed questions across all levels of critical thinking. Remember, critical care might seem intimidating, but you're building the knowledge and skills to handle anything that comes your way. If you found this helpful, don't forget to subscribe to Yes, You Can. Master critical care exam questions on your nursing licensure exam.